Hello everyone, my name is Tarek ElShebiny. I'm a full-time junior orthodontic faculty at Case Western Reserve University and also a private clinician in Solon, Ohio. I would like to take this opportunity and thank the AOF for the support for the 2021 Orthodontic Faculty Development Award. The AOF has generously supported my research projects in the past in the areas of 3D airway analysis and 3D superimposition. The question of the project this year is a little different when you talk about virtual tooth movement. And the question we have originally, if we move teeth the same amount in different software programs, will we get this exact outcomes? And this was answered by Dr. Ilawi in his thesis last year. And the aim of his project was to compare the final outcomes of the same amount of teeth movement in 4 different software programs that uses different algorithms. The software programs were SureSmile, CleanCheck Pro, 3Shape, and MotionView or OrthoInsight. How was the workflow? The workflow that we have started with the CleanCheck Pro, and we consider the CleanCheck Pro is the gold standard because it is the most popular, and we were able to export the final STL files from the CleanCheck Pro and also mimic the same tooth movements in the other software programs, the SureSmile, the OrthoInsight, and the Ortho Analyzer, where we also are able to export the final STL files and then compare the final STL files from those programs to the gold standard, which is the CleanCheck Pro. And if you think about it, you would think that when you put the same exact numbers in 4 different programs, that you would get the exact outcome. It's exactly like a GPS. You take you to the same place through the same direction and same amount of time, but actually the results were different. And here are the results, and you can see there is a color code on the right hand side here where my mouse is pointing at, and you can see the green is 0. So the green you see means there's no differences, but also there are a lot of areas that you can see the orange, the red, and the blue, which shows differences in the software programs. And this took us to the next step. Now we have compared the tooth movement table and compared the outcomes. Now, what if we have the same outcome and then we compare the tooth table movements? What about achieving similar outcomes using the software programs and then see where is the discrepancy in the tooth table movement? I would like to thank my mentor, Dr. Palomo, who has mentored me for the 7 years or even more, for his generous support all the time. And I'll thank all the team members who have worked with me in those projects, Dr. Ilawi, Dr. Stevanovic, and Dr. Dingra. Thank you, AOF, for the generous support.